Hello, welcome to this week's edition of Daily Kos' Debrief with me, your host, founder Markos Moulitsas. Daily Kos is the nation's premier online progressive community. It's a place to learn about what's important and just as importantly, what to do about it. So it is a real pleasure to have you here with me today. And we will be talking about the coronavirus pandemic. My guest today will be Daily Kos senior political writer Mark Sumner, who is a scientist. He's an information savant. He's written dozens of books, and he was on this story about the pandemic from the very beginning, back in January. So we're going to talk to him about where this pandemic is going. Now, the pandemic was in the news this week. Well, it's in the news every day, unfortunately, because between 1,000 and 2,000 people on average are dying every single day from Trump's incompetence and just sheer lack of interest in doing anything about it. And so it has been obviously big news, but it was particularly salient this week because either Sunday or yesterday, or Tuesday, depending on what metric you use, we crossed the 100,000 dead mark from the pandemic. That makes this disaster the biggest disaster in American history since World War II. It is like 2 Vietnam Wars. It's like 35 9/11s. The magnitude of this disaster is almost unfathomable. And what is distressing about it all is that it's an ongoing disaster. This isn't going anywhere anytime soon. Now, there are obviously political ramifications. Donald Trump is going to have to run this November on this idea of keep America great when what he's literally talking about is keeping over 40 million people unemployed, thousands dying every single day. It's not a very salient campaign platform to run on. Now, last week with Daily Kos staff writer Carrie Alaveld, we talked about that 2020 elections outlook, particularly in this sort of coronavirus era. The link to that show will be in the show notes below this video. But this week, we're going to talk to Mark Sumner about what this pandemic may look like in the coming months ahead. Now, obviously, Trump is trying to minimize this. He's trying to act like he's doing a good job. And this clip from The Daily Show really brings home how he has been trying to move those goalposts.
If we didn't do it, you would have had 1 million people, 1.5 million people, maybe 2 million people dead. But we're going toward 50 or 60,000 people. It looks like we'll be at about a 60,000 mark. 60, maybe 65,000. 65,000 people. 70,000, 75, 80 or 90,000 people.
They had minimum numbers of 100,000. And I think we're going to beat that.
If we could hold that down, as we're saying, to 100,000, so we have between 100 and 200,000, we all together have done a very good job.
Of course, he cannot and will not be able to erase the hundreds of thousands of dead, the tens of millions of people who have lost their jobs. And it will be an issue, if not the issue, heading into this November. So to talk more about what this pandemic will look like in the next 5 months, please welcome Mark Sumner to the show.
Hi, Markos.
Such a pleasure to have you here. Mark Sumner, like I was saying earlier, has written dozens of books. He is a scientist. He is an information savant. He knows everything about everything sometimes. It's quite amazing. And Mark, you were on this story back in January when this was a localized outbreak coming out of the wet markets in a far-flung corner of China that few of us had ever heard of. But you were on the story. So can you tell us why or how did you even come upon this story? And why did you realize at that point that it was so important to cover?
You know, what's most surprising about this story maybe is how unsurprising it is I mean, we had already had two major epidemics, SARS and MERS, emerge from this family of coronaviruses in just the last 2 decades. And you also had this region in central China that is known as a hotbed for emerging diseases. That's why there's a viral laboratory there. So when you hear that you've got a new outbreak of a coronavirus in central China, it's kind of like hearing that Michael Bay's going to make a movie. You don't have to wait to know it's going to be terrible.
So, interesting. So what sources were you using at the time to even realize that this thing was sort of germinating and happening at the time?
But really, I didn't know until the World Health Organization knew, right? And now I think in retrospect, there have been quite a few reports that have shown that some of the intelligence agencies and so on had a sense that there may have been something happening in China throughout December. But really, it was right there on New Year's Eve when the World Health Organization made the announcement. China came to them and said, it finally fessed up after having tried to suppress the information, and that's when they first made that announcement that there was a respiratory illness, a new novel coronavirus that had emerged there in that central province. That's really when I kind of woke up and started following the story. And for a few days there, you kind of had sporadic new information before the World Health Organization started giving you daily strategic updates. And really, that was the main source of information for several days. And then you read sources like South China Post, which gave you a sense not just of what was going on with the disease, but going on with China's effort to kind of control the information around the disease.
So there's this sort of mission accomplished vibe coming out of so many elements of our society right now. I mean, you have obviously the Trump administration trying to pretend that this thing is over. You have states opening up to some degree, some more than others. You have people just feeling like it's okay. It's time. We did our duty. We were locked up. We did what we were supposed to do. Now we're going to go to the beach, and we've gotten to the point now where we see that, yet about 1,000 people on average are dying every single day. Now, one of the better known models that are predicting the future trajectory of this disease is the IMHE model out of the University of Washington, I believe. And they're saying that we will have 143,000 dead by August 4th. So that is in 2 months, just about 43,000 more dead, which in itself is a horrifying number. But in your opinion, is it even a realistic number that we come in at just 43,000 dead in the next 2 months?
Well, actually, University of Washington updated their information overnight, so now they're predicting 131,000 dead by August 4th, which, I don't want to pick on the Washington model. No, I'm lying. I do want to pick on the Washington model. It's been heavily leaned on from the beginning to show good or bad things, depending on what the news cycle demanded, right? But really, it's a very simplistic model. It's not an epidemiological model at all. It's a curve-fitting model. So it's just a set of math that's trying to make our curve look like that curve that happened in the Hubei province in China. So it's extremely sensitive to the latest information. So the number will go up and down. We're going to have 200,000 dead. We're going to have 60,000 dead. We're going to have 70,000 dead. We're going to have 140,000 dead. It goes up and down, and it changes literally overnight with small amounts of information. In the end, it will be right because they keep updating. In terms of being predictive, it hasn't really demonstrated any ability at all. One of the things that I'm seeing right now is we're starting to get this sense from people, like you say, that we're opening up, and gosh, we haven't really seen any horrible effects from that right now. But it reminds me, in aviation, there's a type of aircraft called a gyrocopter. Have you ever seen one of these?
No, and this is where Mark Sumner is being Mark Sumner with a great knowledge.
They're kind of like a cross between a helicopter and an airplane. They look like a helicopter. They've got a blade up on top.
Yeah.
But they actually have a propeller that drives them, and that blade on top just spins. And so they were very inexpensive to make, and they used to offer these home kits for making gyrocopters, and people built and crashed thousands of these things. And the reason that they do is because they're really slow to respond to the control. So, you want to turn left and you turn left and nothing happens. So you turn left some more and nothing still happens. So you turn left a little more, and now all of a sudden your gyrocopter spins all the way over and gets upside down and crashes. And I think that's kind of what we're seeing with the response on coronavirus. We open up and nothing happens, so we open up a little more, and hey, it looks, things are still looking good. Oh, well, let's just all go right back to work and treat things like normal. And then, what we're not taking into account is that it takes several days for people to get infected. It takes days for those people to get sick. It takes days for them to spread it to the next generation. So by the time you notice that your opening up has gone too far, you're already in a crash. You're already headed for that next peak. And really, we haven't even exited the first peak.
So what I'm hearing is that 138,000 by August 4th is way optimistic.
I want to be hopeful, and there's the chance, but yeah, it's a very optimistic number.
Now, all these models, the IMHG model, you say it's a simplistic model, but some of them out there may be a little more sophisticated. They're all assuming current lockdown trends, correct? I mean, are they factoring in the fact that people are starting to loosen, whether it's by government or just personal behavior, right, that behavior is loosening up?
I don't think any of these models, there are some much better ones. The ones from Columbia University, which puts out 3 different models, have been pretty good at in terms of being predictive. They've been at least better. But I don't think any of these models really has the level of detail necessary to represent the fact that you've got not just 50 states, but in for example, my state in Missouri, you've got the state doing one thing, Kansas City doing something different, St. Louis doing another thing, St. Louis County and St. Louis City doing different things. So none of these models really has the detail necessary to represent the level of social distancing. So they've got a spot, you can plug in a number. That number really is just changing how fast the virus is transmitted from one person to the next. But how accurate it is in mirroring any of the social distancing measures we're taking, I think not very. Right.
So I'm gonna, and sort of speaking to that, I'm gonna pull up a graph of the 1918 Spanish flu, and we'll put it up here on the screen. And there is a initial bump. The initial pandemic was 5 deaths per 1,000 people. And then that lasted through about July. And then there was a lull for about 3 months. And then you have this massive spike in the fall in October of 2019, up to 5 times the level of the initial outbreak. How much does that graph resonate with you? And do you see parallels to where we may be heading this fall with this pandemic?
I think one of the things that happened with that flu was that flu genuinely is seasonal. It doesn't spread as well in the summer. But right now you can see that the place where the coronavirus is spreading most is in Brazil, which is not a good indicator that we're going to get a break over the warm months. So the first thing that we're probably not going to see in that graph is that nice trough out there where there's a period where it seems like there's almost no cases. We're still on that first peak, and right now we're fortunate that it has gotten a little less steep. And if we can keep it flat, that would be something. But I fear what we're going to do is just move from the small peak to the big peak without having that nice trough in between.
I was looking at Chiles outbreak, and when I first saw that, I thought, well, maybe it's up in the mountains where it's cool. And then you look at the daily temperatures, and it was in the hundreds. So right. That was a sort of a punch in the gut, thinking that we may have a little bit of a reprieve here. So the big political debate right now, cultural debate at this point, not even political, cultural, is the idea of opening up. And obviously you have the Trump zealots saying it's about freedom. On one end, which is an absolutist and absolutely ridiculous approach. and then on the other hand, you have people who say we can't leave the house. We need the lockdown. But I personally think that there has to be some level of opening for mental health reasons, for economic reasons. I mean, people need to eat and pay their rent. I mean, there's just no other option, and definitely can't depend on Republicans in Washington. So, knowing what you know about the disease and how it transmits, what kind of activities do you think? Obviously, you always speak supported by science, but what kind of activities can be loosened and allowed as we move forward?
It's a really unfortunate that the U.S. just politically can't manage the thing that some nations have managed, which is to just have a sense of emergency universal pay, or to pay some percentage of everybody's income for the duration of the crisis, so that there's not that pressure on so many people that they have to get back to work. And you understand why people want to get back to work if they just don't have any income, and people aren't giving them a break on their electric bill, their food bill, their rent. In terms of outdoor activities, I really like, or in terms of activities, I really like the idea of getting outdoor. I feel a bit of a weenie. Just right over there, I can step out the door, and there's a 60-acre lake behind me. So while I'm telling people to stay inside and be safe, on good days I go sailing. So that's that's a little bit of a cheat, I think. But any sort of this is a great time when we've had people talk about how nature's making something of a comeback. We get these sightings, foxes here and dolphins in the canals, et cetera, et cetera. So, maybe one thing that people could do is just use this time a little bit to observe some of that. Go outside quietly. Instead of going outside, doing like the Lake of the Ozarks party, go outside and use this time to kind of get a glimpse of some of that nature while it is handy, before we drive it all back into the hills.
I mean, there seems to be the virus seems to have a difficulty transmitting outside, and most of the outbreaks have been indoors, in situations where people are sort of talking loudly at each other, right? Choir practice or call centers, things like that. Do you sort of feel that it is safer to be outside, and that's something that could be loosened up, even beaches, that sort of thing?
Well, I mean, there's always that aspect of viral load, right? When you get infected by a disease, it's not like a single virus may trip over, lands in your nose and infects you. It's usually a number of viruses, and literally millions of them that enter your system before your system becomes overwhelmed and you have a genuine infection. So if you're indoors, there's just a greater density of viruses. And like you say, choir practice or whatever is probably like the worst thing to be at, right? Everybody projecting viruses. But and some of the hospital rooms where people are working, emergency rooms, gosh, that's an astoundingly hazardous environment. But yeah, outdoors is safer. It's not that, I've had this argument online with people. It's not that opening the beaches can't be done safely. It's that people keep insisting on being idiots when they're out there. If I'm sure that your governor and many governors of coastal states would love to open the beaches if people would respect social distancing guidelines, to at least some extent. It's just that as soon as you see those pictures of giant pool party and everybody stewing together 2 feet apart, that generates a pushback. Not just that, generates pressure on the governor from people who see what they're doing to close it all down again because people aren't being responsible.
In that same sort of thread about opening back up, this is an issue that is obviously quite important to anybody with kids, me included, and that's what happens with schools. If you were in charge, would you reopen schools in the fall, and what would that look like?
Boy, it is really hard to imagine what opening schools safely looks like. One, the idea that kids don't get infected is not true. Kids do get infected, and we're starting to see a lot of children. When we talk about kids and the flu, right, we always have a great concern and we close down schools for the flu, but really the number of deaths and the number of serious illnesses among children is always low. So the number that we're seeing right now with coronavirus, even though it's a tiny fraction of the total number of people who have had serious illness, the number that are getting sick is probably as high as it ever is during flu season. But there are a number of kids I know just can't learn remotely. My wife is a teacher, taught middle school for 25 years, and she can tell you all about all the different learning styles that there are out there. And you've certainly got some kids that are perfectly capable of engaging remotely and staying on top of their topic and working from home, but you've got a lot of kids that also aren't. So maybe the only way that could possibly be done would be some sort of hybrid model where you try to keep as many kids out of the classroom as you possibly could. Those that have good internet access, those that can learn remotely, those that have the resources at home to make it work for them. And you bring back some kids in much smaller classrooms with more widely spaced social distancing guidelines intact.
Yeah, I mean, some of the things that people are talking about here in the local school district is having the kids come in several times a week, so that way you space it out, you have more space. Maybe you do tests at school, so you can police the concerns about cheating and things like that while still doing a lot of the instruction online. I know my kids are both struggling with online education, and it feels like they're just surviving as opposed to actually learning anything. And so this is something that schools are definitely I hope they can figure out a way to manage this and do so in a way that's safe moving forward. So I have one more question for you, and maybe you can settle this conclusively. So we have this big cultural battle over social distancing and having things be open and closed. And a big subset of that is this debate over masks. And you have people who say masks prevent the spread of droplets of saliva, which carry the virus. And thus, you're not protecting yourself with a cloth mask, but you're protecting everybody around you. And if everybody wears a mask, then everybody's protected. On the other hand, you have people pointing to CDC studies that say that the virus is too small to contain in any kind of mask, and that it's all just hopeless, security theater, and that it's an infringement on their freedom, and people are literally getting shot over these masks. So you clearly have been paying attention to the science. You've even written about this. What does the science say about masks, and can you settle this debate at this point conclusively?
Well, I mean, I think it's unfortunate that the CDC really put out a lot of talk at the beginning of the pandemic about that you didn't need to wear a mask unless you were sick, right? But if you're sick, wear a mask to protect everybody else, because masks work best when everybody's wearing them. You can cut down by a percentage if you're wearing a mask and you're sick. You cut down by a percentage if you're wearing a mask and you're not sick. And if you're both wearing a mask, it really drops the number. And maybe the best example there is to take a look at Japan. Japan, throughout this whole pandemic, has really come off quite neatly and had a very small number of cases, small number of deaths relative to other nations. And the thing about Japan is, unlike South Korea, they didn't have a great national program of testing and case tracing. Unlike New Zealand, they didn't go into a really strong lockdown or whatever. Japan screwed this up in just about every way, just about as badly as the United States did. And yet they've got a very small number of cases, very small number of deaths. And I think a big part of that is the national culture of wearing masks regularly, washing their hands regularly, paying a great deal of concern to cleanliness. So I think in this case, Japan was saved just by the things that the Japanese people tend to do on a daily basis. Rather, they were already acting with some of the guidelines that we should have put in place.
Yeah, none of the East Asian countries, as dense as they are, have been hit as hard as Europe and the Americas. And one of my operating theories is that San Francisco, in large part, has been spared the worst because of its large Asian community and their lack of concern about how they look wearing a mask and how quickly and easily they put those things on. And you know, me as a Latino and Anglos, we all look at them, you know, in the past and we'd be like, what are they doing? That's weird. And now it seems to be a saving grace for Asian neighborhoods and Asian communities, Asian countries, that they have those hygienic practices that seem to be stemming the spread of the disease. But how much of that do we know conclusively? How much of that control in Japan was masks, and not maybe blind luck or something else?
We really don't know, and that's going to be one of those great things to study here in the next couple of months, because Japan had some instances. For example, very early at the outbreak, before it was really declared a pandemic, 8 taxi drivers in Tokyo tested positive. And if you can imagine someone better positioned to spread the disease than a taxi driver in Tokyo, right? You're going to have somebody sitting in this car, they're going to be stuck in traffic, and they're sharing air with somebody for, you know, minutes or hours. This seemed like, oh boy, the death knell for containing this thing in Japan. And yet that didn't lead to the kind of explosion that we've had from, you know, one person showing up at a church meeting.
Yeah.
So why it didn't happen is going to be something that's a very interesting topic.
And do we know that they were all wearing masks? I mean, was this early in the pandemic?
This was very early, and we don't know.
Okay.
So yeah, we really don't know the details of this. I can tell you mostly about Japan is that they've like us, they've done a bad job of collecting a lot of data and done a bad job of a lot of case tracing. So how they've gotten away with it is really the question.
So is there science that says, we don't have science yet that says a mask conclusively cuts down transmission?
We do have science that really looks at, you know, the number of, when you talk about the virus again, it's you don't get infected by a single virus. You get infected by, you know, a large number of viruses, and a lot of times those large number of viruses are traveling on droplets. That's why when you're getting in that choir practice and everybody's projecting, you know, and you're blowing those droplets out, you're really much more likely to get infected. So the same thing happens with the mask. It's not that mask is so fine it can stop an individual virus, but it is fine enough to stop those little spitballs you're throwing out. Yeah. And that's really what you're protecting people are. So I don't have the exact numbers right in front of me, but you know, if you look at it, it can be relatively small on either end, right? If I'm not sick, my wearing a mask may protect me only 20%. If I'm sick, and my mask may prevent me giving it to other people by 40%. But if you're both wearing masks, it cuts it down by something like 80%. So,
and even if it was 20%, why not? I don't understand.
Yeah, exactly.
Even 20% is preventing the spread of the disease. But you can see it. You know how moist that cloth mask gets after you've worn it just for a short amount of time. That's liquid that could potentially be carrying virus and spreading it to other people. I mean, just you can tell that it is preventing spit from floating out. And I gotta say, I'm kind of grossed out at all the spit that I've been spitting out for my 48 years of life.
You don't even realize I've got neck gaiters, you know, the little bandana-like things that you put around your neck and really left over from hiking. So that's and most of the time I have not been in a retail store since March 18th.
Wow.
That's the last day I stepped into the local Dollar General, and other than visiting my mother, who's about 4 miles away, and she's 85, so we do go over and visit with her every week. I haven't been in anyone else's house in that same period. So, you know, the best I do is I'll order curbside somewhere, and then I'll pull up my little neck gaiter, and even in the time it takes me to transact a deal there, yeah, by the time you pull it down, it's like, yeah.
So gross. So, Mark, thank you very much for joining us. It's such a pleasure to talk. Always so informative. And everybody, thank you so much for joining us this week. I hope you come out of this conversation knowing a little bit more about this virus and understanding that, no, this thing's not over. no, we haven't reached any peak. The next peak may be a lot bigger than this one. And people's inability to act responsibly is just dragging this thing on. So this is very difficult. We're going to be dealing with this for a while now. Thank you for joining us this week. Please subscribe to the show, buttons below. And I look forward to talking to everybody next week. Thank you to Walter Einkel for producing this show. Thank you to Mark Sumner for joining us. And I will see you next week. Bye-bye.